Let's begin with a clinical vignette. A 30-year-old male, John, who's a laborer by his profession, comes to emergency room after injury at right arm during work. X-ray of arm show mid-shaft fracture of the humerus. Which of the following sensation is lost from this injury? So now I'm going to highlight some important nerve lesion that are related to the humerus fracture. I am only highlight the important landmark that is important for the nerve lesion. So first is the surgical neck. The surgical neck is the area of the humerus. When the surgical neck fracture take place, it will lead to the axillary nerve damage, and it will patient present with loss of arm abduction, loss of arm abduction, loss of sensation at deltoid and lateral arm. Next is the mid-shaft fracture. If the mid-shaft fracture will lead to the radial nerve injury and patient present with the wrist drop, loss of sensation from posterior arm, forearm, and dorsum of hand. Next is the medial epicondyle fracture. The medial epicondyle fracture will lead to the ulnar nerve damage. So the patient present with loss of sensation from medial 1.5 finger, and it also lead to the decreased flexion of these finger as well. And the last important is the supracondyle fracture. The supracondyle fracture will lead to the median nerve damage. So the patient present with ape hand, gap hand, loss of wrist flexion, loss of sensation from lateral 3.5 fingers. In this picture, I am highlighting the areas of hand that are supplied by the different nerves. So, for example, the median nerve, this is the palmar surface of the hand. So the lateral 3.5 fingers are supplied by the median nerve, and this thenar eminence is also supplied by the median nerve. If the lesion of the median nerve take place, then it will lead to the atrophy of the thenar eminence and loss of sensation from this area. So the ulnar nerve supply the median 1.5 fingers and this hypothenar area as well. So this is a dorsal surface of the hand. So the same area is supplied by the ulnar nerve, but the difference is this portion, this dorsum of the hand area is supplied by the radial nerve, and while the tip of these fingers only supplied by the median nerve. So one important stuff about the axillary nerve. So the axillary nerve supplied the deltoid muscle, and deltoid involved in the arm abduction. So the degree of the arm abduction is important. So the deltoid lead to the 15 to the 19-degree arm abduction. The right option of this clinical when it is a loss of sensation from posterior arm, forearm, and dorsal aspect of the hand. And in this mid-shaft fracture will lead to the radial nerve injury. Radial.